What happens to Jesus if I donate my heart? That's the title of a lecture delivered by Dr. Terry Rosell, the Rosemary Flanigan Chair at the Center for Practical Bioethics. Dr. Rosell, first question, how did you come up with that title? What happens to Jesus if I donate my heart?
It was an act of creativity and a reflection on my own upbringing and faith tradition, in which the heart has huge symbolism, religiously and I think also culturally. And it's also one of the organs that we have been transplanting for a number of years. And so reflection on that and on transplant medicine came to that title. We're hoping it's one that is one of curiosity and brings people to come and dialogue with me.
Now, your aim with this talk was to bridge faith and medicine, philosophy and theology, religion and culture. That sounds like a pretty tall order. Could you explain how you're going to, or how you have approached that in the past?
Well, I see religion as arising out of culture and being a cultural expression to the spiritual part of person's being. And so religion and culture aren't such a big stretch. Then to look at medicine and a particular dimension of medicine within that is maybe a little more difficult, except that medicine too arises within a culture. What we see in the practices of medicine, transplantation and others, is that people who are spiritual, most of them also religious, i.e. practicing some spirituality within a faith tradition and a community of faith. Those patients and family members talk about their illness, about their cure or treatments in religious terms. That happens in transplant medicine a lot. So what I do then as a philosopher is to think about that, to think about the terminology that we use, the concepts, what do they mean? What do they mean for individuals, for communities? Faith communities are moral communities, and so we think ethics then when we're thinking about moral communities and what things mean to them.
You focus on the work of Father Bert Cunningham, who wrote about donor mutilation and ovarian transplants in a book published in 1944. In your view, what is it about that work that stands out most to you?
The morality of organic transplantation was Father Cunningham's doctoral dissertation. And I was interested in it initially because it seemed to be the first book-length treatise of organ transplantation issues using living donors. And it was an attempt to try to understand living donor transplantation from his faith community perspective, which is Roman Catholic. So that was interesting to me as a theologian and philosopher, and one who was doing a fellowship at the time at the Vanderbilt Transplant Center. So I read it first as a historical work, and then as one of interest because he was dealing with a sort of transplantation that I had not heard about, that wasn't being practiced to my knowledge, that being a part of an ovary from one woman to another, using living donors, in some cases more often actually transplanting a part of an ovary from a woman to another part of her own body. That was interesting in itself. And then his arguments for the permissibility of that, maybe even the obligation to donate a part of oneself to be used beneficently then by someone who needed it. Very interesting and relevant to what I was doing in areas of kidney, heart, and lung transplantation ethics.
Now, there are some buzzwords that you just used there with organ transplants around religious communities, loaded words like permission and obligation and laying down one's life versus the mutilation of oneself that will come about with a live donation. It seems like it's hard to find a balance there.
We don't use some of those words anymore. Mutilation is not a word that you'll hear in the transplant community. Even cadaveric donor is not used, although that has been the terminology for many years to talk about a deceased donor, and now that is the terminology. We used to talk about harvesting organs from cadaveric or deceased donors, and the terminology shifted to procurement of organs, and now to recovery of organs. Terminology matters. It does in all of life, and it matters especially in a practice of medicine that is grounded in trust and voluntariness. So whether the donor of an organ is living and donates a kidney, for example, or is deceased and may be able to donate 2 kidneys and a heart and lungs and liver and other body tissues, it matters how we talk about that, in part because most of us in the society think it's a good thing.
But there's a comfort zone that needs to be achieved, right? And that's why the language is rather
Comfort,
something that...
I would use the word trust.
Okay.
If the public does not trust organ procurement organizations and transplant physicians, we won't be willing to part with organs either as a living donor or as a family member giving permission for our loved one to be a donor. And until the system were to change so that it wasn't based on voluntarism, and that's not apt to change anytime soon, and shouldn't, then we need to make sure that we are building trust, that we are trustworthy in transplant medicine, and I think that is the case in most all instances. And if we don't speak in ways that build trust, we won't be able to help people through donation and transplantation.
Dr. Terry Rosell is the Rosemary Flanigan Chair at the Center for Practical Bioethics. Terry, thanks. Best wishes in all your endeavors.
Thank you, Laurel.